Okay, Mrs. Jones, I'm Brooke Catheter. I'm going to be your nursing student. I'm going to be inserting an indwelling catheter, and since this is an invasive procedure, I would use 2 identifiers to identify her, like her bracelet, and ask her name and date of birth. Okay, now. Normally their legs would be in like a frog-like position, but since this is a mannequin, this is what works for a mannequin. And I don't want these gloves. Now I'm going to put on my sterile gloves. I would obviously have done hand hygiene and everything prior to this. Shiny side down. Shiny side down. Trash, go outside. Okay. And get my lid ready. In the lubrication. Probably lube it up a little bit generously. And now I'm going to perform pericare. I'm going to commit my non-dominant hand, and I'm going to clean far farthest from me, closest to me, down the middle, and now I'm going to insert the catheter. I'm going to ask the patient to bear down like they're trying to void and take deep breaths. And for a female, I'm going to insert it 2 to 3 inches or until I get urine return, and when I get urine return, 1 to 2 inches more. Okay, catheter is inserted. I'm going to pinch it with this hand and inflate the balloon. There's 10 cc's of saline in here. I'm gonna do 5. Okay. And I'm going to remove this. And since the catheter's in, I'm gonna let my hand go. Stat lock this. And put this on the edge of the bed. Make sure my stat lock stays in place. And put it on a non-movable part, which is not the side rails. So make sure that it's on a non-movable part of the bed. And I'd use more tape if I need to have my stat lock stay. Okay. And that's how you insert a catheter. And then I would document how many cc's of saline I put in, how the patient tolerated it, what the consistency, odor, color, everything of the urine return, and the time. And for removal, to remove a catheter, I would first empty and document any of the urine in the tube or in the bag. And after I emptied and documented the bag, I'm going to bring it up on the bed and remove my, I'm going to remove my stat lock and get all of the saline out of the balloon, which I would know how much saline was in there from the documentation. So I'm going to remove my stat lock and then take out the 5 cc's of saline that the person who removed it has documented. Obviously, after I put in the catheter, I'll make sure the patient had their coli and everything. And it's a very painless procedure. Go ahead and take a deep breath. And I would remove the catheter, dispose of all of my products, and document how the patient tolerated it, the time of removal, and the amount of urine I'd taken out of the catheter bag, and clean them, provide pericare, make sure their coli, a bedside commode, or anything was close by that I thought they might need.